My exceptionality research project is done on bipolar disorder. I used the butterfly as the main page because it seemed extremely fitting, and I'll explain why throughout this presentation and then kind of come back and reflect on it at the end as well. Okay, bipolar disorder is also known as manic depressive illness, and according to the National Institute of Mental Health, bipolar disorder is defined as a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day-to-day tasks. So I felt like that was pretty fitting in terms of students, working with students and understanding why um, a student with bipolar would have a hard time in a learning environment. Just basic day-to-day tasks, like it said in the definition, are hard for those kiddos. So I wanted to read the beginning part of my actual research paper because I felt like it can kind of give everyone a good idea of some of the feelings and emotions a student with bipolar um, is feeling most of the time. So imagine feeling obnoxiously energized, optimistic, and impulsive all at once. Then, a little while later, without any control, you change. Suddenly, the uncontrollable feelings of deep darkness overcome you. This describes some of the emotions a student with bipolar disorder may encounter at any given time. So, a lot of highs and lows for people with bipolar disorder. So, that's a lot of the reason I chose to use that picture on the first page because the black and white side of the butterfly kind of represent all the lows, while the really colorful side of the butterfly represents the highs and the enthusiasm that they may feel during a high moment. Okay, so symptoms of bipolar. Um, like I said before, there's manic highs and depressive lows. So I have the picture of a roller coaster to kind of represent that. Living with bipolar can quite literally be like riding a roller coaster. There's no saying what emotion or feeling is going to come or when it's going to come for that matter. So it might be very up and down, surprising, kind of like a roller coaster. Um, so manic highs can mean increased energy, strong desire to engage in risky behavior, fast talking, impulsiveness, and lack of sleep. Um, so during times of manic highs, a student might, like I said, have that high energy increased, activity level increased. Um, so in a classroom setting, a student might be more inclined to not sit still or be up and moving about the classroom um, and not want to participate in instruction. They might be kind of rambunctious. Um, During the times of when they're feeling risky and impulsive, you might, for example, find them outside trying to climb the tallest tree out at recess or whatever. Um, During manic highs, racing thoughts and speech may happen. The urge to talk loud during quiet times. Um, so increased energy and the fast talking are symptoms of ADHD as well. So it's pretty common for people to get confused or immediately think that if a student has those symptoms that maybe they're ADHD when really they could have bipolar. So another part of manic highs is your student could get a boost in confidence and optimism. And something I thought that maybe could happen during those times is, you know, they could unintentionally bully another classmate just due to their lack of understanding of social cues and facial expressions, and just not really being aware of what their body is doing. So, um, one way back to the ADHD thing, one way to kind of, tell the difference between ADHD and bipolar um, is that ADHD students won't have times where they can, fully pay attention. They won't go in spurts as if they would if they had bipolar, if that makes sense. Um, so for depressive lows, sadness, bursts of crying, feeling sick, and irritability are all symptoms. So most commonly a feeling of sadness that lasts or is something that your students may encounter. So, if they're feeling these emotions, it's really possible they won't have a whole lot of motivation to, be in school or, do their homework or all that. Your student could frequently cry for long periods of times, just about, not really anything worth crying for, but they just really can't control it. Um, irritability is also another common symptom of bipolar. Um, so that obviously can cause frustration in the classroom because simple things could set them off. It's also common for students with bipolar to feel sick. They could complain of stomach aches and headaches often. And so just because of all these things, it's really hard for them to engage in day-to-day activities, let alone, learning and doing homework and whatnot, or schoolwork, I should say. Another thing about the symptoms is that while it's very common for people to experience manic highs and depressive lows separately, um, it is possible for them to experience both emotions at the same time. So, for example, feelings of hopelessness could come with bursts of energy. Um, so their mood swings can occur less drastically, but still be present. So that is called a hypomanic episode. So the cause of bipolar to this day remains unknown, or I should say the exact cause of it remains unknown. But there's a few factors that play into it, and those are family genetics and brain abnormalities. So in terms of family genetics, if somebody close to you, like your mom, dad, sister, brother, if they have bipolar, you are a lot more at risk to have bipolar as well. And then the brain abnormalities plays a lot into it as well. So diagnosis for bipolar disorder has to be done by a doctor. But if you have concerns as a teacher for your student, it is really important you express those concerns to family members or the appropriate people so that they can see a doctor to determine if they do have bipolar and then get them the appropriate help they need. So in terms of initial treatment, once they are diagnosed, a treatment plan can include medications and psychotherapy. So the medications can help a student begin to feel normal again and make it a lot more possible for them to participate in day-to-day life. If it's taken properly, it can have a huge impact on their life and their success in school as well. And then psychotherapy is another way to treat bipolar. So that's basically just talk therapy, like working with a therapist on coping strategies and just how to deal with having so for in terms of basic health help, that is what they will do. And then as far as teachers, I will talk about that on the next slide. What does this mean for teachers? And by that I mean what is teachers' responsibilities before student diagnosis and after diagnosis? Before, following basic steps in RTI is a really basic, way to screen for any emotional behavioral disorders. Um, so the 3 tiers in that, whole group instruction, small group, and then moving on to the last one, with the individualized instruction. It's also important to document your concerns as they come up, just so in the future you have that as a reference. And then if you have a good relationship with your student's family, just reaching out to them and telling them any concerns you may have is really important as well. So after diagnosis, if one of your students is diagnosed with bipolar, some things that are that will help or that you should be doing is asking the student what their needs are, what's going to help them become successful learners, what should your classroom look like, what should instruction look like, the seating, how do you follow the IEPs. So those are all kind of things that I will talk about in this slide as well. So again, asking their needs, which is pretty basic. Do they want the lights dim? Simple things that could make it easier and reduce frustrations for them. So that kind of goes into classroom environment as well. Dimming the lights, reducing sensory overload, and having an organized classroom. If students in general, not even just students with bipolar, if they know where things are around the classroom and are able to do things themselves, that will reduce frustrations immensely. So that's kind of a way to predict antecedents as well, and just make sure to stop frustrations before they even happen. Making instruction time shorter might be a good thing to do with students with bipolar. Their attention span really sometimes might not be that great, so making a really long lesson isn't really going to benefit them at all. Seating, just maybe placing the student close to you so that they know you're there, and you can kind of monitor them as closely as you can to reduce those distractions in the classroom. And then following their IEP. If they do have an IEP, obviously it's important to follow those instructions and accommodate your students, whether that be more time during testing, or if they need someone to read the questions aloud to them, whatever it may be. Just making sure you abide by that IEP is really important. So in terms of supports for bipolar disorder for children and families, the IDEA, Individuals with Disabilities Education Act, is a huge part in that. So basically saying that if your child or student is identified, that we are going to provide the rights and protections to children and families with disabilities, and get them a right plan that has the accommodations to meet their needs. Okay, so I thought it would be cool to end this presentation with this picture of the butterfly again. I think it's a really cool representation of bipolar disorder. The black and white kind of, showing the low side, the sadness, that students with bipolar feel. And then the opposite side of that is when they're feeling really energized and optimistic. The colored side really represents that very well. So, again, bipolar disorder is a brain disorder that causes unusual shifts in mood, energy, activity levels, and the ability to carry out day to day tasks. So, I think that last piece is really important to remember, just that students with bipolar just are really going to have a hard time to carry out day to day tasks. Simple things that may seem simple to you or other students is actually really very hard for them. So, just understanding that and then, making them feel like they are capable and that we're there for them is really going to help them um, with school and learning. So, again, symptoms: manic highs, depressive lows. Um, if you have concerns for them, again, a formal diagnosis by a doctor is required. But as teachers, if we follow that response to intervention and just our basic duty as teachers, we can help identify these kiddos because um, bipolar is really actually kind of hard to identify. I don't know if I expressed that enough already or at all, but especially in young kids and teens and even early adults, it's really hard to be formally identified with or diagnosed with bipolar. Um, so understanding what it is and kind of keeping it on our radar as we're teaching students um, might you know benefit a kid in the long run. We might be able to help them out by simply understanding all of this. And then, what does it mean for a teacher? I guess that's kind of what I just said there. Just making the appropriate accommodations and be willing to work with them and their families. Um, and then, really planning ahead of time before the student even walks in the classroom. What can you do? How can you step in their shoes and see how they might be feeling? And, how can you plan for that and reduce frustrations? And then lastly, we talked about the supports, and that's kind of tied into IDEA and just the right that children have to get the help and accommodations they need.